So Cody and I decided to do a health fair for the residents of 32254. The health fair will be held at a public library. And our main focus is, again, to teach them and educate them about primary preventative care. Immunizations is one of the form of primary preventative care, and it is flu season. Like I said, usually we get our flu vaccine for our primary care, but since our residents here don't have access to that, then where do they go? Duval County actually reported in 2017, early this year, a lot of hospitalization. Around 2,000 hospitalization was already reported for the 2016-2017 flu season, and as well as Duval County primary care spots are reporting 8 to 10 flu-like symptoms coming in to their services. So flu season is, according to the CDC, is between October and December. October to can extend all the way to May, but the peak of it would be coming around the cold times, the winter times, which is December to February. Flu-like symptoms. With the health fair, we will hand out flyers to our residents and teach them what to kind of look out for. We have symptoms to teach them about: high fever, fatigue, body aches, headaches, stuffy nose, cough, and sore throat. We would also teach them, don't wait so many days and weeks before coming to the ER or seeking for help. And the CDC actually said that the only way to prevent flu is to get flu vaccine. Absolutely, that's their main recommendation. We would also teach our residents, how to avoid flu, of course, to get the flu vaccine as the CDC recommended, and the 3 C's: clean and wash your hands, cover your cough when you sneeze, cover your cough and your mouth when you cough and when you sneeze, and of course contain your germs. Stay at home if you are sick so you don't get other people or your loved ones sick along with you. So that's what we're gonna do with the flu. With the health fair, we would offer free flu vaccines for the residents that would attend our health fair. Also, other thing that we touched about is our zip code is high on stroke mortality. Again, a lot of that is we don't have access to primary care, therefore our stroke could happen at any age, but especially to our older adults, we are also high in diabetes, our zip code as well. So they kind of go hand in hand. Lack of access to primary care means lack of education. What is this disease is about? Stroke. With our flyer for the healthcare that we will give to our residents, we would give them education on what stroke is. Stroke is the 5th leading cause of death in the United States, and it is the #1 leading cause of adult disability, and it is also highly, highly costly. The stroke care after stroke is very costly, according to the Duval Health. So with this, we would teach them what every hospital teaches in recognizing the signs and symptoms of stroke, which is fast. If your face is uneven, and if your one arm is hanging, if you're having slurred speech, numbness in one arm, to please call 911 and go to the emergency right away, so that we can prevent this stroke. And if they know that, they know to call 911, and then once they get to the hospital, hopefully we can prevent the stroke from happening, instead of not knowing what stroke is about, not knowing how to prevent themselves from having stroke. And then since they don't have access to primary care, they have a stroke. By the time we find out that the stroke had occurred, it's already at the latter stage where, again, no initial treatment could be done because we're already at paralysis. The speech is already worse. So by that point, then we touch to that higher cost of care after stroke. well, if we give them education and the basic education that they need, we could prevent that from happening. Like what Cody had said, our zip code also has the highest um, hospital stays or emergency visits due to the lack of primary care access. And we strongly believe that if we educate them on these things, we could prevent them from going to the ER. We could teach them what symptoms to watch out for. And again, primary preventative care, we can teach them on how to help themselves, not to get to the worst point, just like with the flu vaccine, know the symptoms, and with the stroke, know the symptoms and how to decrease your risk from having the stroke. All those all help with preventing emergency visits and hospital stays. During our health fair, we would also offer our residents for, if they want to, for free HIV testing, and we would offer them some preventions, such as we would have condoms offered to them if they want to, because again, as Cody said, we have an alarming highest rate of STDs in our between teens between age of 15 to 19 in our area, and that's just unacceptable. I think part of that also is, again, the lack of primary access, because I guess the parents could do as much as we can, but when we bring our kids during this age, part of the thing that the doctor that would discuss with you when you visit primary care is, of course, sex and preventative measures. And unfortunately, our residents don't have that, and we just want to highly educate them on the things that would promote healthier lives for them. Okay. So in conclusion, me and Cody's focus is as you heard over and over again, is primary preventative care, is because that's the best way we can do to help our residents, given the fact that they don't have access to primary care.
These next 3 slides are going to be our references that we've used. Some of them are in the paper as well as here, but I combined them all just for convenience factors. And then our last slide is going to be our contributions. Thank you for taking the time to watch our presentation on our community health project. It was definitely interesting to be able to go through this area safely and see exactly what's lurking about. Definitely could need some help. The people there seem like they're kind of just stuck. They seem helpless because this area is basically all that they can afford. And they don't seem like they have enough help from the city and from local agencies in order to make their living situation any better. So I think that this is going to be a long-term problem. However, I think with our other communities coming together, that we should be able to at least help them and better the situation, at least for the time being, until we can come up with a more long-term solution to the problem. Was there anything you wanted to add?
I think to just add to what Cody said is education. It's important for us to educate them, know the symptoms, know what to report, how to prevent it. At least those things could help them lead a better and healthy lifestyle.
Okay. Have a good evening.